debt, and you cannot send it that my father here to get sorry for to find engage the Pentecostal leader somewhere. And that man is an authority, even if they are really also here, and even in Korea. I think about we are like being massive because they are more than the people we are engaging. The machine I don't know mito kandi baza kubayima ibe n'abazandi akaba bapepata kulia mpi ekibantu barayiki bobo bagambo tuwasenti mali zinonye mukerezi ya n'imizigi kinemuzijyayo nabo nibaisha n'ibitozo bazitu batuziri. So they are there, they engaging many people. How can we help to engage them? Lastly, mukubire mitonga you have seen nibubaga okuzisala mu mafuta gangezo nzireka zisasu mitwala iri musanvu mu mitano ina kuminanya zokka zibatubanja naye era bisikala panja mutukubireko mu ngalo kuliwa naitondaliwo kyayibajabajeno kayino tafire kako omusajja agendeyo mandezirayi zibatekokubaa n'abalala balese mukomera bamalize nga mbebaza bannange olw'okukolera Uganda yaffe amanyi mbadde Kibuuka Francis bazigattirawamu nti azigase nammwe nsanyuse n'okuyita mu kigulu n'okutagayana mwe balidwaliro lyange ly'ebibini bitono bifalo hospital ne kasanga yalesese kafa yateekole eno naye eriwamunyamba nyo we bali mukama kumpi yoyagala.
I would like to request that we use okay. Thank you, moderator. George is my name, RDC, Chibura district. Chibura district in Uganda. I want to appreciate this engagement. Yesterday in my district, we had a six-star review on issues to do with health and medical. I raised the concern, and I'm very happy today that the whole permanent sector of the ministry is here. My sister Diana is here, as of Chinga community, where we are not doing well in the sector. The rest is excellent. Something to do with nutrition, human nutrition. Something to do with human nutrition. Abantu kanibajja kukitori ky'areba. Abantu kanibajja kukitori ky'areba. When, for example, I consider the new brands of drinks that are flooding the market, they someone sits home and manufactures a drink. He goes to the FM radio and puts announcements, especially those to do with energy drinks, In Rwanda here, there is a brand of energy called Rwanda Short. You can't implement this book from the day. Now that cup, now I don't know that somewhere happened when I went for the morning and produced wires. And she has demonstrated the truth works out that everybody can afford that. Now, when I saw it, it's a fire now. Wonder what the fire is. Never mentioned it, so that everybody can afford to take this income. Are we doing better in that sector? Nowadays, on issues to do, on advising people on what to eat and what not to eat. Satisfaction level is cheap. About food get on this one, and the teach how to keep it on our human health. I think this.
Thank you, Mr. DC. Dr. Mali, you respond the issue of energy drinks. I know, Dr. Mugai, most of the energy drinks are done in vain, and the purpose of producing them is anchored on reproductive well. But yes, we respond on the issue of the mortality or the issue of alcohol. I suggest that it's almost okay. Those who are able to write can write. I want to request the PS and the team first respond, the first phase. After that, we shall go to the second phase. Is that agreeable? Yeah, otherwise, people may fail to respond. Let me request PS first to respond to the issues raised. There was also, Dr. Mabisa, there was Mr. Chairman's Peter asked a question, no, made a suggestion on patriotic trainings for health workers. But Mr. Chairman's Peter was my chairman, you know, in your submission, it seems you are forgetting that this is also recruiting. And as the other issue, you have a big stake in shaping the workers who are recruited. Let me ask the case to respond, then Dr. Mabisa will also respond. How about you also respond? And
I think let me just stay here. So on ambulance or Kigezi, we take note. And we, as early as possible, we give the resources, we'll be able to give that. But also we are going to lobby some friends who have been giving, those people, but they are very good for the mountains. We will be able to talk to our friends to see whether they can help us. If you can place a few mountainous area or Kigezi, they could give you some sort of help. We take note also of the gap. I think we've been mainly focusing on only DHOs, and we have not been able to invite the city officers, but we'll change that for sure. At every engagement, we need them because also they have a big catchment area. We have been working with a private not-for-profit. We give them vaccines actually, and they do that, and they don't charge. They are expected not to charge. And that arrangement continues. Why we have not been giving, we've been giving purely private facilities, because I know that those ones, they wanted to charge, and yet we have no control. So that's why we are more working with the private not-for-profit, like faith-based facilities. Those ones have been really good. We are working with them, and they actually doing a lot of immunization. So even for malaria, the same way, we are going to continue working with them to make sure that we have that collaboration to continue. The mosquito nets are distributed every 2 years, and every 3 years. So if the people who have done mosquito nets, they need to be encouraged that by buying a net of 20,000, they are investing in their lives. Not wait until someone comes to Piambe to live. You find someone who is selling coffee, is selling a car, but they cannot save 20 or 25,000 to buy a net. And also, we want people to start owning their health as really a priority. Instead of waiting to get a feeling, if my net gets strong, I can actually go and buy a net, because that is my life. I am investing life. This is my life. So people need to be encouraged, other than just waiting. Really, as spirit of voluntarism, the spirit of patriotism, the spirit of ownership, the spirit of responsibility. You must rekindle and bring back that. Because that's the beginning of recovery, that's the beginning of development. If you work hard, everyone sees that you are contributing to your country, not the other way around. Baba kuchera benda, government, mwacho government, inguramuchi, noni dianga, wene, really three hundred. For all you, need contributing there. Hungary and the Uganda, my sweetest country ever, Uganda, need contributing there in Japan. You won't regard what I am going for the children. Only to Japan, why you only we are ready, yeah. And you don't have to be a leader. No. In your capacity, in your respective capacity, you can actually contribute positively to our sweetest mother. So let us learn that spirit of responsibility and taking responsibility to know that at a time as this in our country, Uganda expects so much from us. Uganda is crying out for people who love her, who will nurture her, who will take care of her, who will fight for her, who will protect her, who will beautify her, who will, make her prosperous. That's what we really want. So even that, even just going and buying a net of yourself, you're contributing to your country by making sure that you lower again the burden of malaria. That's what that is your contribution. So we really want to encourage you. The power back of Dr. Wanswa, I take note, and really this is our desire to see that every facility where we deploy those systems, we have the backup system. And it is about the financial. Even today when I was in the hospital here, because I think end of this month, we are going to, I think we are going to commission the largest neonatal complex in the country, here in Malaria. So, the end of June or early July, we shall come and commission that facility. It will be having, I think, the biggest neonatal babies. Even in Uganda, I don't think it has a number. But I was talking to the director here, and I told him that we need to invest in solar. So to use whatever resources, whatever opportunity we have, we use solar and we install solar so that solar can run those basic equipment. So that when power goes off, it can have continuous services. But also it can lower utility bills. Not only water, but not only electricity, but also water. So that is something that, and actually now moving forward, all our constructions now, we have agreed that really the issue of solar and the issue of water must be mandatory in our facilities, because we've been just building structures, but service completion or service, the whole package of service, it has to encompass all those essential. Water and electricity is very important. So we are fully aware, and this is what we are working on. It's just that the money is not sufficient to do everything. Thank you very much. There are a lot of alliances right now, not just security. You need also to help us to ensure that government programs, that is actually your cardinal role. Government programs are implemented, and that has a lot of components under there. And one of them is to ensure people work. People who have scored, people who don't want to work, people who are weak, people must be shown exit. We are not short of doctors, we are not short of nurses, we are not short of lab people. We should not delay people. We should stop those people. Doctors and nurses, they are like ordinary people, like everybody. If they don't do their work, We can get other people who can do this work. So they should not really put us at ransom. And this is, you are supposed to, like now, here, we have put this accountability. Follow up, find out. Why is accountability not submitted? So if we send money to the district and somehow activities are not done very well or money is not utilized very well, one of the roles, your cardinal role, is to ensure that really government programs are effectively implemented and utilization of resources. One of the things I forgot to talk about is social service committee under PDM. The fourth pillar under PDM is social service committee. We want to activate those social service committees at parish level. For the districts that have even choose, that's even excellent. Because you have already cadres that can sit on those parish social service committees and they give you feedback in real time. We have given them, even those choose, we've given them tablets, we've given them BP machines, we've given them glucometers, we've given them all the gadgets that can help them to go house to house. They capture the data, put it there, so that at parish, at social service committee, when people are discussing service paper at parish level, the health educator is supposed, the health assistant is supposed to present the report of the health at that. So we think that is going to revolutionize. That will be the second phase of NRM. If we implement the social service committees at parish level, and we make sure that we use data to follow up and make sure that whatever issues at parish level are dealt with, that is the second revolution to NRM. I can assure if we do that, we will jump, we will take a big leap into development. Chimpanzee, I have been very fast, even my commissioners, without DHOs, and I failed to get money to take my people to chimpanzee. If there is a way you can bring it up in your forum, the presence of school, they can take the teachers, I think that they support, but for us, we've never been supported. And we really want. If I go to money, all of us will report there, even tomorrow. Because I know for sure. Just we need to go there 2 weeks and discuss serious issues concerning personal responsibility, but responsibility for our country. It will change a little, including the temper. That one I know. Staff who are recently our districts, we are recruiting our staff. But as you know, we don't have enough weight. We are still putting strain with public service and finance. Give us more money so that we fully recruit. It is our priority. Even today, that's the topic I was talking about today at this meeting, that we need to make sure that we secure money and we recruit staff to manage that big complex we are going to commission, because otherwise we will be whited. It is in our plan. Our projections are there, in our budget is always there, but sometimes what we ask is not what we are given. But it is really our agenda to make sure that now alcohol, this one is now alcohol, it is a habit. People to take alcohol. And by the way, Uganda has been the highest. Now it is more dangerous that we are taking certain poison. Now, this is possible. It begins at community level to sensitize people not to do. Because however much you do it, people will be walking with sockets in the office. Even as we are seated here, people can start pulling on the stuff, even in church, even everywhere. So it is a bigger place. It is not only alcohol and not even drugs, real drugs. Young young people, if you go to now mental health hospital in Uganda, people are booking 6 months ahead for rehabilitation because we have no space. All these young people. It cannot be the problem of health. The issue of drugs cannot be a problem of health alone. It has to be a societal, the religious leaders, the community leaders, the political leaders, the gender people in the districts, the education. All of us, we just have to continue dealing with this monster that has come to finish our country. And this one, it is one because we are targeting that I will come I don't have authority to come and close. I'm told here, but they put a funny factory there, and let's make those stupid things. And for me, you don't have even the powers. But they say, no, that is industrialization. That is an investor. That is an investor. Don't touch an investor because they pay taxes. So it may be hard for me. But if the whole population gets to know the dangers of those things, and everybody talks about it, radio we talk, we criticize, in the community we talk about it, the wedding we talk about it, they will campaign until they reduce that price. But the point is that we have alcohol law. We have alcohol control, but has it stopped people from drinking? People are giving but even when we wanted to make it harder, members wanted more than said no, because we wanted, like hours, people should not drink during the day, what they made us fail to change some of those clauses. But it is a societal responsibility all of us to fight this problem. So, and it is not only just alcohol. I want to, at some time back, for example, she was doing very badly in nutrition. Nutrition indicators. Why? Why do you think so? It is not because people don't produce food. People produce food and they sell it, all of it. Abantu ddala tumwatibika obwire bw'omushana kugira ebyokulya byabo b'okuzoma kale nyomba nkulegera kyanjako akabajja leaders bakaba ekyabazoma kwenda kushanga ebyokulya ebyokulya tulite ebyokulya. It was like a responsibility of every household to be capable. Kuchikora kantaka wabana obwire kukabanza kushanga batera abakazi abakazi bagenda ate omukazi akigenda ate ebyokulya omushaija byakira nabyona azamanganga balitw agamba ati obwire bwokubyala buki agaka omukazi amwe mukyalo ate ensonga tusinze abo omukazi namwenda gwekakateza kuyiga okubanizibwa etuuli okuyiga omukazi akushalukula omwana sokera ebintu ebimu nabo bya society yetu nayo tulina okutwalanirawo. So now with the nutrition, by the way, it is a big priority for government. We must deal with malnutrition and the weight, stunting, ebyokulya ebituka abaana baitu, ebyokulya ebitwabika, tuyina okukigamba ekigwe. And by the way, amawulire president akigamba okunonga ntwendabire kitemamanyi. Lastly, ebintu ebikunywa abashaija all abashaija amaana gani gakabagati even the money when ebintu ebikunywa yaza kwarwaza kansa ibintu kunywa ebyo mwenye amaanyi aho niga kwarwaza hata n'omukimanya okenti ebintu ebyo biine mu chemical ekitweta catecholamines ne puedo ya pues cuando me llaman so bueno como digamos como tú no te nunca con shanga pressure ya te va za namba za pesa za mwiwo ndamana stop mun ya ya ma ya re hatata why ne na ke mun ne everyone being chemicals they put some kind of thing on shaka na mara ni jo kule be hade be stand up to na range aba ko shaba be kansa jama ne tuno wai ke de se de bantu yon ke na koma ko na koma kama bali yon na kisa
I actually wanted to ask Dr. Mugai whether this energy drinks really work.
They work. Reverend, as even women are taking it. Yes, there was a question that I consulted about. There's a ambulance of Bosheni, but I consulted the commission in charge of ambulances. Bosheni. This is Bosheni. Chairman tells you 5 Bosheni districts. So it is Bosheni. You received the number plate, but you not received the vehicle. We will be ready in the second week of July from the commissioner.
Supplying the truth. You don't need to supply the truth. They have enough equipment and get to sparkle global funding as good. For how I did that one about Africa, with South Africa. Inquiry about people was a foreign and US, yes, it was Jews only come to be one that some so ambulance is on a correspond. For in ambulance, and bed, for what you want to tell that's a confident like so to the people to govern receiving on
issue of management team. Issue of management team. Management team.